We may just have to call him. Well, hello again, everyone, and welcome to another in our series of informational webinars to support our business community's owners, managers, and employees. Today, we're fortunate enough to be joined by presenters from Healthy Androscoggin, which is working to create a community of thriving residents by giving individuals tools to live healthy lives. I'm Scott Benson. I'm the Economic Development Director here at the Chamber, and I'm here to help you through this Zoom video conference. To that end, I want to remind you, we're recording this session. We'll provide you with a copy for your future reference. We do ask that you mute your audio if you're not speaking. We do invite you to turn on your cameras so we can see you if you haven't already. And lastly, please feel free to use the chat feature throughout the presentation to ask questions or make comments. And then at the conclusion of our presentation, we'll open it up for a Q&A with our presenters. So with that out of the way, let's get started. Our topic today is spotting substance use disorder and what to do about it. This seminar will discuss how to identify the signs and symptoms a staff member might exhibit if under the influence of alcohol or drugs, including marijuana, at the worksite. We will also discuss the steps a business owner can take to minimize the risks to their business and employees may face due to impairment. So participants will learn the most common drugs misused, signs to look for in staff who may be impaired, how to prevent misuse, and strategies to address potential misuse. So our presenters today are Mary Caron. Mary's been, she's a substance use and tobacco prevention coordinator with Healthy Androscoggin. Mary's been at Healthy Androscoggin working on tobacco and substance use prevention efforts for the past 2 years. She has her master's in public health for the University of Southern Maine. And also, Emily Dooling Hamilton, who is also a substance use and tobacco prevention coordinator. Emily's been at Healthy Androscoggin since the fall of 2010 as a health promotion coordinator. She has her master's in health promotion and disease prevention and is a certified prevention specialist. So Mary, Emily, thanks for being with us. It's all yours.
Thank you, Scott. And Mary's going to go ahead and pull up the PowerPoint. And as we're doing that, I'd like to welcome everyone again. And our thought for today is that we'll have some great PowerPoint slides, and we'll, like Scott said, you have an opportunity to use the chat box, and we'll kind of open it up at the end as well for questions. And Scott also did a great job introducing myself and Mary, but I want to take an opportunity. Renee, would you be willing to introduce yourself as well?
Hi, so I'm School Resource Officer Renee Bernard, law enforcement for almost 28 years. I've been a school resource officer for about 15 years, and we presented this similar PowerPoint last year in high school. And I work with a Students Against Destructive Decisions group at the high school, Lisbon High School. And I also am a DARE instructor and have been for about 25 years. So that's who I am.
Great. Thank you so much for joining us today. And like Scott mentioned, we're going to discuss how to recognize drugs, paraphernalia, and signs of impairment, and what you folks can do when encountering it. Mary, do you want to go ahead and again, Scott mentioned this, but Healthy Androscoggin, we're located right in downtown Lewiston, but we serve all of Androscoggin County, with the exception of Livermore and Livermore Falls. We have 5 main goals. We support tobacco-free lifestyles, prevent youth substance use, encourage physical activity, and promote healthy eating, as well as prevent childhood lead poisoning. And this next, actually, we're going to take a pause and pull up a video, and this video is from the Drug Free America Foundation, and this is a nice just snapshot of what we're going to be talking about throughout this presentation.
Sorry, just have to get to the video.
Mary?
It's not opening the right Zoom window. I'm sorry. There we go. All right.
Mary?
Most companies make every effort to provide a safe, healthy work environment for employees. Yet substance abuse and addiction have become very real threats for many of them. Data shows in the past year, over 9% of full-time workers were dependent on or abused alcohol or illicit drugs. That translates into a steep drop in morale and productivity and an increase in absenteeism and accidents. In some countries, companies are losing billions of dollars a year. So what can be done? Well, the most effective way to prevent alcohol and drug-related consequences on the job is through a drug-free workplace program. It gives employees the support to get help and allows those in recovery to maintain their sobriety. When both management and staff are involved in the program's design, review, and enforcement, it can be incredibly effective. Here are 6 steps that your company can take to create a drug-free workplace. Assess the needs of your company. Develop a policy involving key stakeholders. Educate employees. Train supervisors. Create an employee assistance program. Implement a drug testing protocol. Employers that follow these steps can dramatically improve the safety and well-being of their workforce. For more details and other useful resources, visit the National Drug-Free Workplace Alliance, a division of Drug Free America Foundation, at ndwa.org.
Thank you, Mary. And again, that's just a quick, brief snapshot, a nice video from the Drug Free America Foundation. And this slide really takes a look at a map that we actually will share with you folks after this presentation. But this is data from a testing company, Quest Diagnostic, that really analyzes millions of urine tests throughout the country and in the US. And the map points out positivity rates across the country, across the county, and the map shows us that Maine has a higher rate of urine drug test positivities than the US. It's at 7.5 versus 4.5. And Androscoggin County specifically has a 6% positivity according to their data. You know, if we dig a little bit further, the map also shows that the largest increase of positivities has been due to marijuana, and this may be likely because of the legalization, with some increases in amphetamine positivity as well. We'll cover identifying impairment and what employers can do later in this presentation. And again, we'll share this map at the end with some additional resources. You know, there's some measures of impact, obviously, of drugs in the workforce. You know, we take a look at compensation claims, worker compensation claims. Around 38 to 50% of all workers' comp claims are related to substance abuse in the workplace. We can look at medical costs as well. Substance misuse, substance abusers or misusers can incur 300% higher medical costs than non-users. Whether it's absenteeism, they're 2.5 times more likely to be absent 8 or more days a year. Some of the misuses of substances. Substance misusers also are 1/3 less productive, data shows. And you know, there can be employee turnover. It can cost businesses an average of $7,000 to replace a salaried worker. You know, some additional impacts, whether it's tardiness or sleeping on the job. Maybe there's some after effects from substance misuse, whether it's hangover or withdrawal, that can affect the job. Whether it's difficulty concentrating or poor decision making. There may be theft, unfortunately, at the workplace. Maybe there's a lower morale of coworkers due to substance misuse. Again, higher turnover. There's trainings of new employees as well. So just wanted to cover some of those measures, some of those impacts for substance misuse among the workforce. And these are some definitions that we wanted to kind of quickly go over before diving in. This really takes a look at, again, some definitions, but I wanted to touch upon the word misuse versus abuse. Although abuse is a clinical diagnosis, it can really be stigmatizing. One, because it negates the fact that addictive disorders are a medical condition. It also puts blame solely on the individual with the illness, ignoring environmental and genetic factors, as well as the ability of substances to alter brain chemistry. It can absorb the selling and promoting of addictive substances and any wrongdoing. And it also, lastly, can feed to the stigma experienced not only to the individual with addictive disorders, but also the family members and the addiction treatment field. So really wanted to just talk about that quickly. And the first definition, use is the consumption of drug or alcohol consistent with with appropriate laws and social responsible manner. The definition, misuse, the use of a drug for purposes not intended for. So using Vicodin for a headache or Xanax for nausea, a simple way to feel better. The use of alcohol in certain circumstances, where it's prohibited. At work, during required absentee periods, while operating a motor vehicle. Abuse, that's the use of drug for effects other than its medical purposes, to get high or to alter one's psychological state. The use of an illicit drug. The last one on this slide is addiction or dependency. So a psychological or physical inability to stop consuming alcohol, a chemical, drug, or psychoactive substance, even though it's causing psychological or physical harm. This can be characterized also by an increased tolerance and withdrawal symptoms. To kind of continue on the effects of alcohol and drug use, intoxication, affected by alcohol or drugs, especially to the point where physical and mental control is markedly diminished. Impaired means diminished in function or ability, unable to function normally or safely because of intoxication by alcohol or drugs. And then under the influence, affected by drugs or alcohol. Bottom line is, folks, that these terms are used interchangeably, and employees affected by drugs or alcohol at work really should be identified to protect themselves, their coworkers, and the public.
And I'm going to take it over from here, and I'm just going to cover some of the general physical signs that might be present in someone who has misused a substance and is under the influence at work. And I'll invite Renee to chime in here if she has anything to add, because this is the piece that we've really presented together a couple of times now. And those physical signs that we're going to talk about here are really some of the best indicators that someone is impaired, and they can be some of the most easily observed. So we are going to start with depressants, and so specifically alcohol. Alcohol is, with marijuana, probably like one of the top two substances that someone might be under the influence of while at work. And so, if I asked anyone on this call, what are some signs that someone's under the influence of alcohol, you could probably give me many of the components on this list, as far as someone exhibiting that drunken behavior or appearance, drowsy, sluggish, slurred speech. One that's not on this list, they may have bloodshot eyes, have some odor of alcohol on the breath, which it can be a really helpful and good indicator. And as we go through each category, I'll also bring in some information about the duration of effects, because that can really play a role in workplace use and whether someone shows up under the influence. Because depending on how much someone uses and what category of drug they use, it might stay in their system longer than they think it would, and they end up showing up to work under the influence. So alcohol, for example, is metabolized at about 0.015% per hour. So someone who has a 0.15% blood alcohol content, it would take 10 hours for them to get back to a 0% blood alcohol content. So just pieces to keep in mind as far as how there may be delays in effects, and there may also be extended effects that someone doesn't expect to happen and then comes into the workplace. And we've got a video here. I have two, but we're only going to share one just very quickly. And this horizontal gaze nystagmus is a test that law enforcement uses to identify folks who have been using alcohol. It's something you've probably seen on like any sort of traffic stop type situation. And I can let Renee speak to it a little bit more. You generally have to be trained to do this test, but it's a good example just to show. So I'm going to quickly share that, and I'll hand it over to Renee if she wants to mention a few things about this test and what folks will see. All right. So as you could see in that video, I couldn't really talk with the sound over it, but the eye, as it moves to the end of that path, kind of bounces back and forth. And Renee, I'll let you chime in here.
Yeah, so what you really, when you watch the video, what you're really noticing is there's a process to doing this test. First, you're checking to make sure the eyes are tracking the way they should. So if in the beginning, that's what the officer's checking, is just that equal tracking. And then at the end is really where you saw when they really slow the eye down and bring it out to the side, is when you're seeing that involuntary jerking. So it's a great test, and depending on how many clues we have, can really help us judge whether or not somebody is impaired, at approximately a 0.15 blood alcohol content. So.
Thank you, Renee. And so just so you all know, these videos will be sent out after, so you can kind of look for those signs a little bit better. There's another video as well that actually has like an arrow come onto the screen. It's just quite a bit longer, so we figured we'd do this one for now. So I've got to switch my screen here again to go back here. So a couple of other depressants that we should mention, things like Rohypnol or Roofies, Valium and Xanax are other depressants. And so something that is really important to mention here is just because someone is prescribed a drug, so Xanax, for example, doesn't necessarily mean they're going to be impaired. And so when something is prescribed by a doctor and it's taken as it's intended to be prescribed and at the dose that that doctor prescribed it at, likely that person is probably going to function better. And so, the piece of impairment and misuse comes when a drug is taken not as prescribed. So that is all we have for depressants. And
Before you switch slides, yeah. Can I just say something real quick?
Of course.
I do want to point out, so if you're looking at the general indicators, everything except for that bottom, the odor of alcohol on the breath, a lot of those other things, sometimes we can see, and we'll probably get to this later, with naturally occurring medical conditions, such as diabetes. So if somebody's having a diabetic episode, they may appear, to be under the influence. So I know that personally, when I've been roadside and talked with drivers and I'm not getting that odor, a lot of times, sometimes I'll ask, like, is this the way you normally talk? If it's more of a thick slurred speech or some sort of a speech impediment, or I then will go into, do you have any medical conditions? So definitely in the workplace, you may not know if somebody is diabetic, but it is a good piece to remember.
Thank you, Renee, for adding that piece. It's definitely gets here, but I think it's helpful to remind folks of that throughout, that, you know, not all of these symptoms are immediately going to lend themselves to this person is using a substance and they shouldn't be using it at work. A lot of other things could cause some of these problems. Cannabis, another example here, I think of where some, you know, for example, someone having very bloodshot eyes is, yes, a symptom or a sign that someone might have used cannabis, but it can also be a sign that someone has really bad allergies, or, you know, that someone had a really terrible night and was crying and their eyes are all red. So I think it's important definitely to get that context as well. And we'll talk about some of those non-physical signs beyond these. So cannabis, again, any cannabinoids. So it can be consumed in different forms, and those different forms are going to have vastly different durations of effects and onset. So someone who's smoking a cannabis product is likely going to exhibit effects pretty quickly within, you know, a few minutes or so, maybe 10 minutes, whatever it might be, depending. Whereas someone who has an edible product, it's going to take a lot longer for those effects to show. It could take an hour, it could take 2 hours. And those effects of an edible are probably going to last a lot longer than those of someone who's smoked marijuana. So some other signs, odor of marijuana is of course a sign, although again, not 100% sign in the same way as alcohol on the breath, because you know, people might be around someone else who's used marijuana and smell like it. You know, they may be, you know, have a grow at home or something along those lines. There are many different things that could cause that. Some other behavioral signs, things like body tremors or eyelid tremors. I have a video of that we'll show in a second. So those involuntary tremors. And then those behavioral things like being relaxed as far as their inhibitions go and having a really poor perception of time, possibly. And so we've got 2 more videos here, and these are the last 2 videos. I know it's a pain to switch in and out, but that cannabis eyelid tremor example, and then the convergence test, which shows how that convergence test is administered, and Renee can explain a little bit more about that as well. Okay. So this is the field sobriety convergence test. So I'll play that and then let Renee.
Arms down at your side. I want you to look at the tip of my stimulus right here. You see the silver tip of my pencil? I want you to follow that with your eyes only, not moving your head, okay?
All right. Renee, did you want to?
Yeah, so just, I mean, what that test shows is if somebody is under the influence of marijuana or one of those other derivatives, what will happen is when the officer brings the pen closer to the nose, what will happen is involuntarily, much like HGN, is one eye will pop out. It won't be able to track with the other eye to be kind of a, what's the word I'm trying to think of? Where your eyes narrow together, but I can't think of what that's called.
You can't cross your eyes?
Cross your eyes, thank you. So you're unable to do it, you know, and that's what happens is, like I said, I mean, as you're watching it, it's kind of comical when you do see it, but it's just that one eye just darts out. So that's what they're looking for.
And then here we have just an example of eyelid tremors from cannabis use. I did not realize that video was so blurry. I apologize. It went in and out of being in focus there. I will get back to the slides. Did you have anything else you wanted to mention on that end, Renee?
I think generally for tremors, what we normally see, again, when we're dealing with people, it's more of a full body kind of thing. And the best way I could describe it is almost as like if somebody's adrenaline was really pumping, you know, so if they were very anxious or excited or cold, you know, you kind of get that whole body thing that happens. And a lot of times if they're wearing like loose clothing, that's where you really see it, is their clothing is just really tremoring. And that's very indicative of the marijuana stuff.
Thank you. Yeah, and then again, here we have a couple of pictures of just the eyes. The eyes can be a good indicator. I already talked about the bloodshot eyes maybe being indicative of other things as well, but the pupils will usually be dilated as well with marijuana or any form of cannabis use. And marijuana in the workplace is definitely a topic that, you know, there have been a lot of changes as of late. And so here I just have a screenshot of a handout created by some folks at the Maine CDC specific to what employers can do and what they can't, and the laws. That's something that we'll send out as a resource afterward, along with a Maine Department of Labor guide to marijuana in the workplace. But basically what it boils down to is employers do have the legal right to ban possession and use of marijuana while at work, and prohibiting reporting to work while under the influence of marijuana. And they can discipline employees for those things as long as it's in a policy. It needs to be, you know, in a written policy. It can't just be something that's decided after the fact. It needs to be included in that drug-free workplace policy. But they cannot penalize an employee for having a medical card or for being a licensed medical marijuana caregiver. So you can feel free to review those, and we can help answer any questions to those as well. If you have questions now or at the end, we can definitely try or forward you to some folks that might be able to clarify on those ends as well. So next we're just have a few more kind of drug classes generally that we're gonna kind of speed right through here, provide some details on. So stimulants, things like cocaine, Ritalin, Adderall, all of these types of drugs are gonna speed the body up. So you see examples here in the list like restlessness and excitation, exaggerated reflexes, body tremors again, being really talkative, and again, dilated pupils are another example there. Hallucinogens, things like Molly or LSD, might lead to some dazed appearance or complete disorientation, fantasy speech, things like that. But again, it's important to note that some of these signs and symptoms could be confused with other behavioral problems or mental health issues or things like that. Someone who's exhibiting signs of mental illness might not necessarily have the dilated pupils, though, that someone who is under the influence of one of these drugs might have, and they might not necessarily be perspiring excessively, which is another sign of those hallucinogens. And then we have like opioids and opiates. Those are the one drug class that are going to lead to constricted pupils as opposed to dilated pupils. And so that's a piece to be in mind of. And on this list, we have on the nod. So that's just a way of saying, you know, someone who's exhibiting those droopy eyelids may look like they're falling asleep, you know, really having a hard time staying with it. And those depressed reflexes and things like that. And then inhalants are the last one that we just have some brief signs to cover. You know, they might be really confused, have some, you know, be dizzy, slurring their speech. But again, these could be indicative of another problem, and it's not necessarily always that substance. But inhalants as well, you know, it's more likely that someone might have a residue on them from inhaling that substance, whether it was from an aerosol can or a paint or something along those lines. Did you have anything to add on those four, Renee, or?
No, I think most of them are pretty self-explanatory, if you will. I will just say with inhalants, and I think I shared this the last time we presented this, we actually had one of our detectives who was working a patrol overtime shift come across somebody who was parked in a public place, and he had been parked, so I mean he wasn't like operating under the influence, but he was sitting and using something as an inhalant. It is quick dissipating, so generally, you know, the high only lasts, you know, 5 to 10 minutes, But yeah, that is something that we do see. I mean, this is a grown man. We tend to watch for it in the school setting just because it is, you know, more or less something that they can have access to more so than an illegal drug. But there are adults out there that are going to use these things.
Yeah, thank you. And that, I think, kind of parlays perfectly into the duration of effects. And so this little table can kind of help with that. Obviously, every drug in each of these classes is going to have different amount of time for onset and duration, but these are just, you know, some basics. So as Renee said, those inhalants, it's a pretty much immediate effect, and it, you know, might last 5 or 10 minutes, depending. It could last a little bit longer, but generally those are shorter. Stimulants might take effect really quickly and generally will last at least a couple hours, maybe an hour or two. It always depends on the drug. Hallucinogens take longer to have their onset, but their duration tends to be longer for one of those drugs. And then narcotics, it really depends on the specific narcotic that is being used as far as what that duration might be. Some have a significantly longer duration than others, but that is just a table. And like I said, you'll get all of these at the end, so you can use them as kind of a source of reference as well. And then jumping on over to some of those non-physical signs. So, you know, there might not always be an opportunity to check someone's eyes out and see what their pupils are doing. And so, you know, as far as in the workplace, it's important to, you know, take signs together, and, you know, it's not going to be just one thing that tips you off. Although odor of alcohol on the breath might be the one thing that can tip you off, but focusing on the things that you can see and hear and smell. And so these signs don't always have to exist, but, you know, they may, and it's just another tool to give some examples here. So some of these performance related signs, things like seeing lower productivity than normal, absenteeism or tardiness, which were things Emily got to at the beginning, decreasing work quality, or accidents or mistakes that aren't common for this person, might be good examples. And I think a lot of this kind of boils down to getting someone talking a little bit and kind of knowing employees as well. So if it's their supervisor knowing them, and they can kind of identify changes that are happening, that's, you know, out of the norm. So being able to identify things that are out of the norm, and get someone talking to see if you can find out anything new. And then some other behavioral signs. Emily already talked about a couple of these, but as far as thefts and, you know, secretive behaviors, changes in attitude. And over here we have kind of these 5 Ps. So changes to personality, participation, performance, people, and public image. So of course, these aren't going to be indicative of a substance use problem on their own, but if you see changes of these over time, they can be an indicator. Not to say they necessarily will be, but they can be. And just an opportunity to think about and keep those pieces in mind. So as a workplace, you identify someone that has been using a substance at work. You know, what do you do now? If they're impaired, they can't be at the workplace any longer. So now what? And I do just want to point out, you know, we're not lawyers. We're not giving any sort of legal advice, but this is kind of just an opportunity to share some resources and tools generally. And, you know, if you have really specific cases or instances, definitely talk to your HR folks, your legal representation. But we hope to provide you with some resources to at least get you a start on that end. So the most important piece is going to be for a drug-free workplace policy. So having a policy in place. So, you know, what is your workplace policy on substance use? Has it been reviewed? Is it meeting the needs of your company and your employees? And that was something in the video at the start, talking about, you know, assessing the needs of your workplace and, you know, getting management and staff involved in making sure that the policy is well developed and is clear. And then making sure that policy is communicated and enforced. Do supervisors know what to do if they notice something? Do all employees know about the policy, and are they well versed and educated in it? Do they know, if you have a drug testing procedure, what that procedure is? Things along those lines. And that's another question as well is, do you need to have a drug testing protocol or not, depending on your situation? Some folks are required to because they receive federal funding. Others are not, but choose to. And that's going to be a workplace decision. But testing can also be a helpful tool to help rule out drugs or alcohol as the cause of some of these behavioral or physical signs that we talked about before, and how some other things might be able to cause these. And here we have just an example log. And so documentation is your friend completely as far as keeping keeping track of any incidents and what action was taken, making sure that your enforcement of your policy is consistent and that it's well documented is going to serve you well. And then here we have a couple of pieces to go along with that policy. So just for your reference, that the main substance abuse testing law is in Title 26, Section 680, and that controls testing that's not performed in response to federal mandates, which I mentioned before. And so a couple of notes on testing. Like I said, it can be helpful to rule out drugs or other substances as the cause of a problem, but it's important, to document the signs, like I said, focus on those things that you can see, hear, and smell, and, not making it personal to that employee, doing, the same thing with every person to make sure you're not discriminating or doing anything along those lines. And to administer a testing program in Maine, you need to have a written policy in place, and the Maine Bureau of Labor Standards does have to review and approve it. They have template policies that can help with that. If you have more than 20 employees, you need to have an employee assistance program to test so that folks can get help if a problem is identified. And then here I also just included some other resources from the Maine Department of Labor. An example here is an observed behavior checklist. This can be another helpful documentation form. And we'll send this out as at the end. It's a sample from the Department of Labor. But, and then also just making sure that policy includes information on what you do if someone is found to be impaired. Not letting them drive home, making sure are they going to have to call a friend or family? Are you going to get them a cab? What's your procedure? And every workplace might be different in that sense, but having that covered in a policy so it's clear for you, but also the person who's never seen this policy before and has to pull it up. Hopefully they've seen it before. I shouldn't say they've never seen it before. Hopefully they're well trained and versed in it. But if there's turnover and someone new comes in, knowing where that policy is and what to do in those circumstances. So here we just have a bunch of other resources, and again, these slides will all be sent out, and we'll also have a Word doc that just has all of the links, since I'm not sure the slide links will work specifically when it's PDF'd, but these are some resources for folks. And then we've got some time here at the end, about 15 minutes or so, that we just wanted to leave that, you can ask us any questions you have. And there's our contact information. I'm sorry, I didn't put Renee's contact info, but if you get in touch with us, we can definitely forward your question to Renee. But that is all we have for you all today. And like I said, there are plenty of resources coming, but we just wanted to give a brief overview and leave plenty of time for any questions you all have. Thanks.
Okay, great, guys. So we're at the point now where, Katie, Virginia, if you have any questions or comments, you can unmute, share them now. Welcome any questions or comments. I just, for my part, I'm looking at all the sort of tells, I guess, is the way I describe them. Things that employers would have to look for. It seems, at least from my part, pretty daunting. I mean, what's been your experience out there in the community? Have you worked with businesses and helped them kind of through this, maybe develop policies or get their staff trained? I mean, as a business person in the community, what's been the reaction to this? Or do you see companies that have already, are ahead of the curve on this? I mean, what's been your experience?
I will say, part of our job at Healthy Androscoggin is working on policies, and we can help. Mary had mentioned these great resources, and if after these resources are shared, you're interested in whether, it's over Zoom, we have the opportunity to provide technical assistance and kind of work with a business on adopting a drug-free policy or working to enhance their drug-free policy. And I think that, that's part of our day-to-day, and we're absolutely open to help with technical assistance when developing a policy. Mary, did you want to add anything?
Not really, not on that end. I think, like you said, we're open to developing policy. There is another question here, Emily, and I don't know, I could take it or you can, but Katie had in the chat box said, and if an employee has indicated that they have been struggling with substance use, what is the best thing to do? Refer them to an EAP. And I would say if you have an EAP, that's definitely the ideal option. That's what those programs are created for, to provide that support to employees, so they can get the help that they need. So did you have anything to add on that end, Emily?
And again, thinking back to that policy, so if a worksite or a business has that policy in place, and if and when an employee comes to, whether it's HR, or just comes or shares with a coworker or supervisor, you have that in place, you have that resource at your fingertips to really help that employee, because it could be that one time, the one time they come, or it could be, it depends. But if someone reaches out, I think having those tools and those resources can be just so important.
Something that comes to my mind as well on the policy development side. I mean, as you guys do your work, and maybe there's example policies or things that you can build a program off of, but obviously, are there differences between, like, if I've got a production type business where I've got people on a line versus like an office setting? Are there subtleties that might be in one policy and not in another, or are they pretty universal, can be matched to any sort of application?
Well, I think, one of the important pieces of policy development is, including the folks that are affected by the policy in the development, right? So, getting staff members. So the staff members in an office may have different feedback than in a manufacturing setting. In a manufacturing setting, there might be a really much higher risk of injury if someone's using a substance at the workplace, if they're using machinery and things like that. So, there are definitely subtleties in that sense, and it's, I'd say, very case dependent, but it's also important to get that input and assessment and feedback and kind of anticipate those types of nuances and problems.
Great, thank you. So, do you want to give out, any other further opportunity? Thank you, Katie, for logging into the chat there to ask that question. I've been staring at the chat box throughout here, and somehow I missed that one. So I appreciate you guys picking that up. So if we have no further questions, last call.
And I will just jump in and say, if you do have any questions, like Emily and I said, reach out to us. We're happy to help. We have the time and the grant funding to be able to support businesses with this kind of stuff. And we want to be able to, make sure folks are healthy and safe, COVID or otherwise. That's
a really, really important point, Mary, is this agency does exist, and particularly this division of it, really to help the community live healthier lives. So that's really the important point there, is that this is an ongoing resource to our business community to get help in dealing with what are really complicated and complex issues. So other thoughts, Mary?
I just have one more thing. We do have a short evaluation that if folks on the line don't mind filling it out, we would love your feedback and input on this presentation, and we'll send that out at the end as well. But Emily's going to drop it in the chat there. It shouldn't take more than like 3 minutes. It's very quick. And it's helpful for us to be able to learn from and improve what we're doing.
And so this will also be part of the follow-up that comes out of our office, sharing materials that you've seen and have heard talked about today. So this SurveyMonkey survey will go out as well as part of that. Well, I think we're there, folks. Really impressive presentation with a lot of information, and I know that particularly as laws and I guess mores change in society, this is something that is particularly on the medical marijuana front, and then eventually the recreational. These are things I think that are going to be top of mind with businesses as we come through this and return to something like normal in the future. So I want to thank you guys for being with us. Katie and Virginia for joining us, and then obviously Mary, Emily, and Renee for lending their expertise to the program. So again, many thanks to Healthy Androscoggin and also to Renee. We'll continue to offer these kinds of educational seminars and webinars as we go forward as your local chamber. So again, thanks for joining us today, and we wish you a good afternoon, and take care.